Your embryos will be assessed numerous times throughout your journey with CFC. Our aim in the lab is to identify the best quality embryos at each stage, as these are more likely to implant and become a baby. After fertilisation, the next check is on day 3, known as cleavage day, where the embryo is graded according to the number of cells, the size and shape, multinucleation and fragmentation. It's normal to have varying levels of development, but ideally the embryo will have divided into 6 to 8 cells of similar size and shape. The embryos will hopefully contain minimal fragmentation, where small parts of the cytoplasm inside the embryo start to break away or fragment. Low levels of fragmentation can be normal, however very high levels can indicate that the embryo is starting to degrade or break down. One of our embryologists will call you on day 3 to discuss your developing embryos. Between days 3 and 4 is when we are most likely to see the biggest decline in embryo numbers, as the embryonic genome activates and the cells start to compact and form what's called a morula. Until day 3, the egg drives most of the embryo's development. From day 4, the sperm's role increases. So this is when the quality of the sperm comes into play. Reduced sperm parameters can affect embryo development, resulting in only a few embryos making it to Blastocyst stage on day 5. On day 5, your embryos will be assessed for Blastocyst formation and embryo transfer. Blastocysts contain 2 cell types, one that will form the baby and one that will form the placenta. Both cell types must be present and be of good quality to potentially achieve a pregnancy. Similar to day 3 development, embryos on day 5 are often of varying quality. Here is what a developing embryo looks like under time-lapse photography. This is another stressful time for patients as they wait to hear how their embryos are maturing. It is important to note, on average, only 40% of fertilised embryos are actually expected to reach the Blastocyst stage, and not all of those will be of high enough quality to transfer or freeze. Embryo transfer can occur anywhere from day 2 to day 5 following your egg collection. Viable embryos that remain after transfer will continue to be cultured in the lab, where they will be assessed on day 6 and day 7. Only good quality blastocysts will be frozen for future use. An embryologist will contact you on day 7 to let you know the final outcome of all of your embryos.